purposes of this, just to make the video faster, I did raise the bed to a comfortable height already, just because it's very slow. But I would first start by coming in, providing privacy, introduce myself, identify who the patient is, or the client, look at the wristband, see if they have any allergies or any pain or issues before starting, and educate them and let them know that I'm going to be inserting a catheter. Hand hygiene, my gloves. Provided with me today, I have a bath blanket so that I can give the patient more privacy. I'm going to let them know that I'm removing their top sheet so that their legs are fully exposed. Letting them know that I'm placing this on top of them so that they feel a sense of more comfort. So that they're still cold. I'm going to examine the vagina to see if there's any redness, any discharge, any other underlying issues. There's nothing wrong. Cover that up.
Now going to sit down and
I do not have washcloths with me, but on a normal occasion, I would have at least 6 here for peri-care. I would let the client know that I'm removing the gown. I'm going to start with the first washcloth, furthest side, then come to the closest side, then go down the middle. After peri-care is done, I'm going to leave that there. Raise the client's legs so that it gives me space so that their feet and legs do not touch the catheter kit. I'm going to remove my gloves, dispose of them in the trash receptacle. For this purpose, I'm just going to put them here.
I would also check to make sure there's no air bubbles within the tube itself.
I'm going to get the kit out now. Actually, no, I'm not going to do that. I'm going to get a new pair of gloves on, grab the kit out. Place the kit here, opening it away from me, bringing the sides down, and the side closest to me down. Taking the gloves out.
Open inside the sterile field still.
Sitting on my dominant hand first.
And if it was empty, I would dispose of it. So now I'm going to take my non-dominant hand. And I'm going to...
Okay. Now that my hands are sterile, I will now grab the sterile field.
Dora, and I'm going to clean it.
Making sure that the
top to bottom.
blue side is down.
Grab another one and further side away. So grab another one and close side clean. Those.
I'm going to remove this because we do not use these. So that's the garbage.
I'm just going to insert.
I'm going to get my kit out and prep it. Unfortunately, this kit does not have the lubricant. Oh, no, I lied. The lubricant is in here. So I open the lubricant, place it in here, so that it's prepped for the catheter to insert. I'm going to remove the cap off this garbage. Remove the slip. Being very careful not to allow the yellow part to touch any unsterile part. Garbage. And I'm going to pre-prep this by inserting this in here.
Typically, I would ask my assistant to help me
is already ready. Then I would begin by taking the swab sticks, starting from furthest side, closest, spreading the lips, cleaning from the meatus down to the anus.
Applying water.
And then this would go into the garbage. Remove the catheter from the box. And we're going to remove the specimen container because we're not getting the specimen today. Garbage. Placing this into the lubricant and then letting the client know that you are going to begin inserting the catheter. And always make sure to keep your non-dominant hand placed here, do not cross fields, and begin inserting. You want to insert up to 2 inches until you see a flash of urine, and then an additional 2 inches. And you begin by slowly inserting 10 milliliters of water into the bubble, and making sure to pay attention so that there is no water being retained in the tube here, that your catheter is inserted well enough. Inserting slowly.
Going to check the urine output. Okay, everything seems to be good.
This would go into the sharps container, not the garbage.
Yeah, I was pulling your glove on, and I don't know if you saw.
Okay. Now, okay, so hand hygiene. I would clean my hands off, put a new pair of gloves. I provide pericare again, further side, closest side, then top of the vagina down to the anus again. And hygiene again, new gloves. I would then tape this to the patient's left leg and make sure that I place this on a non-movable location on the bed, as so that it does not tug, or there are no problems with it getting pulled out. Oh, and I almost forgot a step actually. To make sure that the balloon is fully inflated and that this does not come out, you are to tug lightly until you feel resistance, and you leave it. So this would go on the side of the bed here. Just gonna pretend that I put it on there. Everything after the client is clean. This is all now garbage. Going to bring the client's leg back down. Cover them up. Provide them with their dignity. Remove the bath blanket. Place this in a dirty bin container. Cover them back up with a top sheet. And then I would begin to lower the bed, raise the head of the bed up to the patient's request, give them their call bell, and identify any other needs prior to leaving the room. And that is catheter care, or inserting a catheter.